Well, we know what a terrible headache feels like, but imagine a pain in your face that is so bad it has even driven some patients to take their own lives. Here to talk about this condition called trigeminal neuralgia is Dr. Dean Sutherland. Dr. Sutherland, thanks for being with us this morning.
Morning.
All right, so let's talk about this. It's kind of a mouthful, the name, but it's more common than you might think, correct?
Actually, it is. Supposedly, the statistics are 1 in 15,000, but I know from my practice that I actually see quite a bit of it. And it is very, very painful. It's a sharp stab that goes into the face, and it can come in waves. We don't really know what causes it in most cases. Sometimes it can be from facial injuries, it can be from dental procedures. Most of the time, we just don't know. It comes out of the blue. So
it's a nerve condition, is that right?
Right, and the nerve gets irritated, and then once the nerve gets irritated, it's very hard to get rid of it. You can have it for the rest of your life.
Oh, wow.
And in fact, one of the monikers for it, one of the little sub-names, is called the suicide syndrome.
Oh, geez.
Because it can get bad enough where people will
bad.
actually take their own lives just to get rid of it.
Wow. Okay, so let's talk about, some of the symptoms. If you might be experiencing this, what you'll feel.
Usually it's a very quick jolt into the face. In fact, some people say it almost knocks them on the ground. It's like like getting electrocuted.
Oh my!
And it usually comes in jolts in 2 or 3 ways, sometimes up to 20 of them at a time. And it can be triggered by chewing, laughing, crying, sneezing, talking.
So just about any normal function we're doing throughout the day. Okay.
Anything with the face, yeah.
Okay. So if you are experiencing something like this, is this like something you need to contact your doctor about immediately, or what's the treatment?
This one you really need to hop on quickly.
Okay.
Yeah, the faster you get the pain under control, the better. If you let it go for a month or 2, it really can become more of a chronic condition. It can be associated with things like shingles, and that's more obvious because at least you have a rash on the face. But later on, it becomes more of a chronic pain syndrome without the rash. So the sooner that you think you have something like that, contact your doctor because there is treatment for it.
Okay, and let's talk about some of those treatments.
The main treatment right now is an old medication we have called Tegretol, which we use for seizures in children and adults. But actually, it's been out for 30 or 40 years. It still is the best treatment. And about 90% of people will respond to that.
Okay.
But that's not known.
Good.
Most people who don't know about trigeminal neuralgia will treat it with other drugs because they think they're less toxic. This is the way to go. You got to get this drug on board very early. And if that doesn't work, there are some other things that can be done. There's other medications and there's some surgical procedures, but those are less effective. In fact, the surgical procedures can often make the pain come back worse.
Really? Okay, so this is something you really have to get to your doctor on soon. And how do you know the difference between if you're having like a brain aneurysm, if you're having a migraine, if you're having this? How do you know the difference?
It can be very difficult.
Yeah.
But usually the big tip-off is that it's a really quick jolt, a quick jab. So migraines are usually more of a kind of an achy thing that will come on slowly. A brain aneurysm is very rare, but usually also does involve headache. Whereas, stabbing directly into the face, one of these divisions of the face, is pretty characteristic for a trigeminal nerve.
So no matter what your condition is, if it's something that serious, the pain is that bad, no matter what you think it is, talk to your doctor immediately.
Quickly, yes.
Okay, all right. Well, thanks for being with us this
Thank you.
morning. And now let's head over to Chuck, take a look at our roadways.
Thanks, Haley. Morning.